For several months, Burnaby Health Services, family doctors, and the Burnaby Division of Family Practice have been actively engaged in developing plans for how we're going to come together to improve patient care in our community. We call this our Primary Care Network Blueprint. We now have a joint vision for the future of primary care networks in Burnaby. We know what outcomes we want to achieve, and we've mapped out the initiatives that we need to meet these outcomes for patients and providers.
The great thing about our vision is how closely it's aligned with the Ministry of Health policy papers and the desire to create primary care networks, creating neighborhoods of services where GP practices come together, sharing care and leveraging expertise with other healthcare providers, ensuring optimal care to patients in their communities. The Burnaby Division and Fraser Health are very proud of the work that has been completed. We are confident we are well positioned to move forward with the development of primary care networks for Burnaby.
The population in Burnaby is growing significantly. We are very concerned about our ability to keep pace with population growth if we don't take active action now.
We believe that through our overall plan for the primary care networks, we will be successful in attaching patients in primary care in large numbers. This is a bold strategy. The incubator clinics will have a supportive team environment, allowing us to attach and care for the majority of unattached complex seniors who are known to Burnaby Home Health. They will form part of the clinic's overall panel. We think the numbers could be in the hundreds.
Burnaby's primary care network design is organized around neighborhoods of 50 to 100,000 people in size. We believe we have 4 neighborhoods today, potentially more in the future with population growth and densification of the city. There are several components in our PCN blueprint, including primary care teams that integrate into the GP practices that transition to fully functioning patient medical homes, GP to GP networks, incubator clinics to foster the establishment of new GP practices and to serve as a learning and teaching center for the new team-based shared care model for primary care delivery within the neighborhood, addressing the need for urgent primary care response within the local neighborhoods, neighborhood wellness hubs, and strengthened integration with municipal and non-profit community services. At the heart of this model is the drive to bring services closer to the practices and their patients within their bigger neighborhoods. This will not only help us serve patients sooner with fewer patients falling through the cracks, but will also allow us to reduce inefficiencies and redundancies in current referral processes.
As the family doctors of Burnaby, we care about our patients and we care about our community.
In all our neighborhoods, our members have been actively engaged in creating this plan with our Fraser Health partners.
We're working together to meet the needs of our patients.
Burnaby is an attractive neighbourhood for a young new GP and his or her practice. I moved to the area of Burnaby about a year and a half ago now, and there's a sense of community here. It's a positive place for sharing care. Young GPs or GPs who are starting out in practice want to feel part of a community and share patient care with other GPs. This is why I'm in Burnaby. I'm excited to be able to influence the way we serve patients in the years to come.
I'm a keen advocate of providing full-scope primary care and believe this is achievable by coming together as family physicians. By sharing care, we're better positioned to serve our patients' needs from cradle to grave. The Burnaby Maternity Clinic is a great example of shared care among GPs. The clinic is helping to preserve the function of maternity care for our entire community, allowing all of us to better provide full-scope primary care.
I am an international medical graduate that's now settled in Burnaby. I love working here because of the support and the energy of this community. I'm involved in many of the projects to advance patient care with the division. I see these projects as essential. I have joined the GP network in my neighborhood. I think that this could be one of the most important things we can do in our community for our physicians and our patients.
I'm excited about the potential for our practice to go to a population-based funding model. I see it as freeing us up to take on patients to help out with our community's attachment challenges. There's an assisted living facility with 300 residents in my neighborhood that we know need a GP. If we want population-based funding, we could attach those patients to our practice. Our practice is excited about the opportunity ahead of us.
I'm ready. It's Burnaby's time.
I'm ready. It's Burnaby's time.
I'm ready. It's Burnaby's time.
We're ready. It's Burnaby's time.